everyone. Um, I'm in charge of digital health at Yonsei Medical Center. Thank you for the invitation. I'm sure that you might not be quite familiar with digital health and digital health response, but we decided to use this name to reflect that our strategy and our vision going forward is going to focus on digital transformation. I am a radiologist, and as you can see from the slide, what I would like to touch upon today is going to be a the meaning of digital health. Of course, I'm not the main representative of the medical system itself, but as a person who works at a large university level hospital, what we are thinking in terms of digital health. So I think there could be many different terminologies that could be used to describe digital health. But I think my favorite term is basically the use of ICT in support of health and health related fields. It's quite clear. And I would say that the statement was made and clarified at the WHO World Health Organization statement back in 2019. And you can see that it starts with AI and ends with telemedicine. Now moving on to health definition. When you say someone is healthy, that means it's the absence of disease or infirmity. That was a definition created by the WHO, World Health Organization. But you can see that there was a change back in 1948. It says being health is the state of complete physical and mental and social well-being. You can see it is encapsulating more of a broad and comprehensive status of a human body and being. So health is basically to support the state of complete physical, mental, and social well-being. I think this is a very accurate way of depicting the status of health. And I think digital health care is something that is more frequently used compared to digital health. But when you say health care, there is an agency that provides the care. So when you say you're giving health care, then there is a recipient. I think this is a very passive use of the term. So I believe that digital health is more inclusive. It is a terminology that addresses more stakeholders and players who are in the health care industry. And I believe that since the advancement of human civilization, there were a major 10 medical advancements. And I think number one would be a vaccine, and then also the invention of anesthetics, germ theory, medical imaging, antibiotics, and organ transplants, antiviral drugs. There are first nine things. And I would say the last puzzle of this 10 medical advancements would be AI or digital health. That would be maybe the last 10 keyword to the top 10 medical advancements. AI could be included in the term or a concept of digital health. So if you go to a very detailed corners of this area, if you think from a perception of digital health, I think if you are going to think about a certain future, you can say that some people say something's going to go first and something's going to follow. What matters is who or which technology is going to be adopted first and which technologies are going to be adopted late. So, um, because I don't have the right to um, talk about what's going to happen in the future, what researchers tend to do is to go back to and refer to relevant reference points or literature. So I would like to talk about the digital healthcare service industry nurturing strategies created by the Korean government, the central government, and you can see some interesting keywords that are mentioned in this report. Number one is I think the government is focusing on a due diligence, like verification process, whether it's valid or effective or commercializable. And also, I think digital treating device is being emphasized, and support device for artificial intelligence diagnosis is mentioned as well. Mobility based remote healthcare service is mentioned. And if you look at some other areas, you can see that mobility will be connected through the 5G technology as well. I think how I interpret this is that the government is now assuming the use of remote and tele Medicare when they are planning for or trying to adopt different policies in the medical industry. You can see that digital health related software, if you can divide them into two different types, I think this distinction is quite important because if it's a non-medical device, it is very easy to avoid regulations. Whereas if it's a medical device, then there is a sanction up front. But once you pass that barrier, then because there's the interior barrier to protect your own device, you will have a better advantage or ground for your use or commercialization as well. So when it comes to medical devices, these are going to be used for diagnosing or treating a certain disease. SAMD would be AI related solutions, digital treatment, VR, AR, metaverse solutions are included. And for non medical devices, it is to collect health data and to record lifestyle as well. So for due diligence process, I would say there are two different hurdles. Number one is KFDA hurdle, and the second element would be being eligible for national health insurance. So getting KFDA approval, that means you can release or launch your product into the market. That means you can use it for human body. It's stable and safe enough, and you can also sell it. But that doesn't mean that it is valuable enough to be used for a patient. There's no proof that it is going to be actually curing or treating a disease. If it's approved that way, then it'll be registered as a standard of care, which is a totally different approach or level. And if you look at the image on the bottom of the slide, there is continuous blood sugar measure that was launched back in 1999. This was approved by FDA, and it was now covered back in 2020. This means that it took almost 20 years to pass that verification or due diligence process. So you might think that, oh, medical officials are so conservative. Why don't they just adopt it more quickly? Why does it have to take 20 years to make sure that it's used? I don't think it's good or bad. I think engineers and physicians have a different grammar to understand the use of different technologies. So, for example, for lung cancer, this is number one killer of humans, and this also has the number one morbidity as well among all cancers. So, for just simple chest PA, no one says we need to just use the simple imaging, because by doing it, we won't be able to early diagnose the cancer. So as a result, there is low dose CT on the right side of the right image. You can spot a lesion that's quite small, and we can't really use chest CT as the main indicator because of the dose of radioactive materials. And by using and adopting low dose CT, we were able to avoid many misfoundings of lung cancer. And because contrast itself is quite good for lung cancer, we don't need to do any additional IV treatment as well. And physicians decided to adopt this low dose CT as the standard of care for diagnosing lung cancer. But you can't be that simple because there is a concept called lead time bias. So from the appearance of symptoms to death, even if you early diagnose lung cancer, you can see it might seem that the survival period itself is growing because you detect it early, but if you actually calculate the time between symptoms and death, even if you do and apply the same regimen or same care, the survival rate doesn't change. There are some lead time bias that we have to overcome. So once we overcome the lead time bias, we can use it as a corporate or group usage of a specific device, and that is why it takes such a long time. So I think maybe Korea is number 2 in the world. This low dose CT was included in 2019. So if you look at other cancers, you will get diagnosed after like 40 or 50 or something like that. But for lung cancer, there's a quite specific criteria. So it has to be over 54 and under 74. And there's also a specific criterion. If you have ever smoked before, then it's considered a important risk factor. Let's say you smoked a pack of cigarettes every day for 30 years, then low dose CT cancer screening is going to be conducted as well. And I think this is a report made last year. And whether we do low dose CT, the impact is going to be valid or not. The report says, oh, it is valuable, it is remarkable, meaningful. Some reports say, oh, there's not quite clear benefit from doing that. So there's still debate in the industry. So software as a medical device, this concept can be addressed in 4 different areas. This is different from conventional healthcare medical devices. Of course, software as a medical device is not harmful to human bodies, and a medical device has to be composed of software without hardware. It has to be an overlapping area between digital health and medical device. And also, software can be updated multiple times a day. But if you think about how medical devices work, even for a small and minor update, you have to get an approval every time you make an update. But for software, you can't really do that. You can't run it that way. So FDA decided to adopt the free pre-cert methodology. So basically, FDA will give an approval to a company rather than a specific device or the version of a device. So I believe that medical AI or digital cures and treatments belong to SAMD. And these are the verification protocols that you have to utilize and follow. It says valid clinical association. What does that mean? Let's say NICU death rate is predicted and there's an AI solution to prevent as much death as possible. And I think you have to understand if pastors are coming more frequently, then the death rate increases. Of course, it could be true, but I don't think there is a medical correlation or clinical correlation between the visit of pastors and a death. So we have to make sure that input data is correctly put in, and you also have to look at analytical validation and clinical validation data points as well. One is missing here from the slide. So I think ultimately what matters is clinical utilization, whether the adoption of a device is improving clinical utility of a patient. Clinical utility is probably maybe the coverage of national health insurance. And moving on to digital cures, I think this is a hot topic in the industry as of now. This is, uh, let's say, probably a new treatment which will get an approval from the national insurance coverage. I believe it's going to be probably a digital cure. The reason why I'm saying this is because workload management or efficiency management is what we have been focusing on in a software concept, but digital cure is more of prescription based. So it's quite interesting. You can see some of the examples, such as Reset, which is a drug abuse or drug addiction treatment, and Somnus, which is insomnia treatment. And another axis of SAMD would be clinical evaluation. You can see that at FDA, AI oriented medical devices show that 61% are related to radio or radio image devices. So you can see that 61% of FDI approved AI medical devices are focusing on imaging technologies, and 18% would be improving the quality of image or video. And the pain point of radio imaging is that it takes a long time for analysis. And if you cut the time, then the quality or resolution of the image drops. So I think AI-based digital devices are trying to resolve that specific issue. And if you think about remote telemedicine care, it was difficult so far because of the legal limitation in Korea. But by adopting telemedicine, we can cut the time and we can prevent the waste of time quite significantly. So there's a clear benefit. But the problem is that there's lack of evidence, and also using the end-to-end full range information utilization. And now I would like to move on to the area of digital health business. You have to look at why people succeed or why people fail. Of course, number one reason is running out of cash and fail to raise new capital. This is obvious. And if you look at a specific article about AI technology being used to early detect pancreatic cancer, you can see that the title of this article says Joint Study for Early Detecting Pancreatic Cancer Using AI Technologies. CT imaging will help contribute detecting pancreatic cancer without giving IV injection. There are so many fancy words included in the literature, but would you pay for this? Would patients pay for this? From medical perspective, as I mentioned earlier, CT would. Do you think this is a reasonable or legitimate way of detecting a cancer? Don't you think there will be more constant pros? And do you think early detecting pancreatic cancer will also improve the outcome of a patient? That's debatable because pancreatic cancer, because it advances so quickly, many physicians agree that early detection won't really matter. So technology's perspective, it's quite viable, but whether this is going to be commercialized or not, whether it's going to be commercially successful or not, there's a clear debate between physicians. And this is actually a successful example. Um, if there are many people who are doing JBurn a lot, then there is a JBurn prediction model. You can see that 50% is decreased due to the establishment of the model, and a failure's case would be 0. This is to provide quantitative information related to sleeping. You can see that all you provide is how good of a sleep you had, but after that, what are you going to do using the information? There's lack of process afterwards. Sorry, I think I'll jump to my last slide. Sorry, I've been blabbing too much. You can see that there are big trees and also small and thin trees on the left side. Unfortunately, the digital health I know is closer to the left side. There are minor and small specific technologies that are springing up, unlike a big tree with a big root. So, from startups or small companies, the left environment is much favorable to them. Thank you very much.